Good afternoon, everyone. Thank you for attending our session today. I wish that we could be together, but that would not be wise given the current situation, so here we are. I'm Colleen Massey from the Pharmacy Outreach Program at MCPHS University, and I'm here to talk to you about programs and strategies that help with medication costs. Today, I will talk a little bit about our program and some of the programs and resources that we use to help people get their medications at a lower cost and strategies that can be used to lower medication cost. Thank you for having me. Because I work in education, I must have some learning objectives for you today. So, by the end of this session, you will be able to describe how the Pharmacy Outreach Program may help you with your medication-related needs. You'll be able to explain the benefits of having a medication checkup, which is one of the services offered by the program. You'll be able to identify programs offered through private outlets or the state and federal governments that may help you with costs associated with your medications. You'll also be able to identify strategies that might help save money on the cost of your medications. So let me tell you a little bit about Pharmacy Outreach. We are a free information and referral service with a mission of helping people take their medications correctly. To do this, we help people obtain and afford their medications. We help people get the medications they need by addressing any barriers related to cost. We also help people by educating them about the medications that have been prescribed to them by their healthcare providers, like what their medications do in their body, why they take them, what are they treating. Together we feel addressing these two things will help people take their medications appropriately because they can actually afford them and they're knowledgeable now about the medications. We are funded by the Commonwealth of Massachusetts, Executive Office of Elder Affairs. MCPHS University houses our program, and that's where we're located. The Central Mass Agency on Aging and the City of Boston's Age Strong Commission. We are a nonprofit and we don't sell any products. We're a helpline here to help you. So give us a call. We are available Monday through Friday, 8:30 to 5, and you can reach us at 1-866-633-1617. So just drilling down a little bit more on what do we do. We answer questions about medications and diseases. You may see commercials during the nightly news or have questions about new medications that might have been prescribed by your healthcare provider. We can do research about these medications or about disease states and medications used to treat those specific diseases. We provide a review of your medications called a medication checkup, which I'll discuss more in a few slides. We evaluate insurance plans like Medicare Part D and Medicare Advantage plans to find you the best coverage at the most affordable price. We have Shine counselors on staff who can help with this. Typically, we provide a lot of community programming at our senior centers, public housing sites, on different topics related to your health and accessing prescription medications. But as you know, we can't do that right now, so we're doing it virtually. We also research ways that you can save on the cost of your medications. This is an individualized service that we provide for free to all callers. So let me take a moment and tell you about a service the Pharmacy Outreach Program offers. Our pharmacists offer free medication checkups. And I know today's program is about resources and strategies to help you with medication cost, but this is a valuable service that's free to you and you should take advantage of it. This is a medication checkup is a thorough review of all of your medications, including your prescription, over-the-counter medications, herbal products, and vitamins. This service is important for people who take a lot of medications, have multiple chronic conditions or diseases, have been recently discharged from a hospital or prescribed a new medication. Honestly, it's a benefit to anybody who takes medication, and it really doesn't matter how many medications you take. So why have a medication checkup? Because of all the benefits of having one. Working with a pharmacist can eliminate any potential drug interactions. You'll experience fewer problems because you'll learn how to take your medication properly. This includes the time of day to take each medication and to take the medication with or without food, and the types of food your medication should be taken with. At the end, you'll have a better understanding of your medications because the pharmacist will talk to you about what the medications are used for, what each of them, what condition or disease they treat, and what the medication does in your body. All of this will help you have better control of your health conditions. Better adherence to your medication is one very important part to effectively managing your chronic conditions. Some tips to follow include getting organized. Use a pill box and carry a medication list or card on your person, maybe in your purse or your wallet. Know your medications. If you know what your medications are used for and how you are supposed to take them, you're more likely to stick to your medication regimen that has been provided by your healthcare provider. Read the labels. The pharmacy provides important information regarding your medications. Dispose of your medications properly. The first option would be to take the medications to a drop-off location at a local police department. There are certain medications that are suggested to be flushed if you cannot take them to a drop-off location, and this information can be found on the FDA's website. I'll include a link at the end of this presentation. So now that I'm done talking about the importance of getting a medication checkup, I know that all of you are going to call pharmacy outreach and sign up for one. That would be great. At this point, I'm going to transition to state and federal programs that help with prescription costs. So I'm going to talk about Medicare Part D. Medicare Part D is one program that helps to pay for medication costs for individuals over the age of 65 and under 65 determined disabled by the Social Security Administration. This benefit of the Medicare program is provided by private insurance companies, either through a Medicare Advantage plan or a standalone prescription Part D plan. So again, you can get your Medicare Part D prescription drug coverage by adding it to your traditional Medicare A and B. You might recognize these plans like Humana, SilverScript. These are all standalone Medicare Part D prescription drug plans. Here you would have two different cards for your coverage. So you would have your traditional Medicare, the red, white, and blue card, and then you would also have your prescription drug plan card, your Medicare Part D plan card. Or you can get your Medicare Part D coverage through what's called a Medicare Advantage plan, or Part C. And that's on the right-hand side of the slide with the circle around it. You might see this through Tufts or Blue Cross Blue Shield HMO or PPO, where those companies offer a product and it includes your Medicare A, your hospital insurance, your B, your medical insurance, and your D, prescription drug coverage, all in one benefit, so you have one card. So I just talked to you about Medicare Part D, and that's one way that you can get your prescription drug coverage. And a lot of people over the age of 65 get their medication coverage through Part D. Part D isn't complete coverage, so sometimes you have to look for other assistance to help you with the costs associated with Part D. And Prescription Advantage is a state program that can help with those costs. Like I said, it's a state pharmaceutical assistance program that helps you with some of the costs associated with Part D. Some people experience a gap or a donut hole with their Part D plan. You may notice that the cost of your medications go up at some point in the benefit year. They might have been like a copayment price, and then they go up to a higher price. Prescription Advantage at that point, when they go up to that higher price, can help by lowering these costs in the gap or donut hole to those copayment prices. So Prescription Advantage works as a secondary insurance to Medicare Part D. So when you go to the pharmacy and you have this benefit, they're going to bill your Part D plan first, and then they'll bill Prescription Advantage as a secondary insurance to help you in that donut hole. It's a free program for most individuals if you're a household of one and your income's up to $37,470, or if you're a household of two and your income is below $50,730, the program is completely free to you. If your income is above this but below the amounts listed on the table in the bottom row, it does cost you $200 a year to be a member of the plan, and the benefit starts once you've spent $3,745 out of your own pocket on your medications. Once you've done this, then your medications are absolutely free to you with this extra insurance provided by Prescription Advantage. But it does take some calculating to see if this is indeed going to happen. You know, if you're going to spend that $3,745 out of your own pocket on your medications in the benefit year or not. The folks at Pharmacy Outreach are very well versed in this and skilled, and they can figure that out for you. If you find that you're in that category, you know, the bottom row there in that table, if your income is in that level where you're going to have to pay $200 a year to be a member, then we really should evaluate you to see if you're going to get a benefit from the program. If your income is lower than that, so up to the $37,000 or up to the $50,000, depending if you're a household of one or a household of two, I advise everybody to join because the program's absolutely free. It doesn't cost you anything, and it's just extra insurance. And even though you may not need it now, you don't know what's going to be prescribed in the future, so it might benefit you down the road. Why not enroll if it's a free program? So you can enroll in this program by calling Prescription Advantage at 1-800-243-4636. Or again, the case managers and staff at Pharmacy Outreach can help you with this process. So here's an illustration of how Prescription Advantage could help you. See how in the coverage gap the medication aripiprazole is $166.93. Someone in this benefit category with Prescription Advantage as a secondary payer will pay $7 for the cost of this medication in the coverage gap. That's because it's a generic medication. Someone in the same benefit category for Lantus Solo Star will pay no more than $18 in the coverage gap. So that medication will go from being $108 approximately in the gap of coverage to $18 when the pharmacy bills Prescription Advantage. That's a huge cost savings. So you see this whole list of medications that this person takes, the cost and the coverage gap for them adds up to about $343. With Prescription Advantage as a secondary insurance to their Part D plan, that would go down to about $42. That's a savings of over $300 a month while in the coverage gap. Extra Help is another program that helps with the cost of Medicare Part D. This is an assistance program run by the Social Security Administration, so you can apply by calling their 1-800 number or by going to their website. This is listed below on the slide. This program is not another insurance plan like Prescription Advantage, but a defined benefit that's actually linked to your Medicare Part D plan. The Extra Help program lowers the cost of your premium, deductible, and co-payments associated with your Part D plan. If you are single and have income up to $19,380 with assets below $14,610, or if you're a couple with income up to $26,100 and assets up to $29,160, the program is absolutely free to you and you should join to get some help with the cost of your Medicare Part D plan. Here are the benefit categories for your reference. You see that there's two benefit categories. One is called full extra help and the other is called partial extra help. In the column to the right, you can see the income limit, and then the next column, the asset limit, and then the benefit that you get in these two different benefit categories. So for example, if you qualify for full extra help, your co-payments with your Medicare Part D plan would be no more than $3.60 for generic medications and $8.95 for brand name medications. You would not experience any deductible with your Part D plan, and you would not have to pay a monthly premium if you selected a plan that has a premium below a benchmark. So there are many zero premium options available to you. If you qualify for partial extra help, given the income and asset limits, you would have co-payments of 15% of the cost of the medications up to the catastrophic level of the benefit, and then you would get them for the $3.60 and $8.95. You would have a deductible that you would have to meet of $89 first before you're able to get your co-payments at the 15% cost, and you would benefit from having a reduced premium. Still a great benefit because as you probably know, a lot of deductibles with plans are in the $400 range. You have to pay that amount before you get any help with your medications, and co-payments tend to be way higher than 15%. So now we are moving from the state and federal programs that help with the cost of medications to private programs that you can tap into to get some help with medication cost. So special generic pricing programs. There are several supermarket chains and retail pharmacies that offer special generic pricing programs to anyone regardless of income. Each store has a list of generic medications that they offer for a low cash price. For example, metformin 1,000 milligrams, 180 of these pills for $10. Keep in mind that this is a cash price, so the pharmacy is not billing your insurance when you use these programs. It is also good to note that if you have a deductible with your insurance plan, purchasing the medications through these sources actually delays you getting out of the deductible. So this may or may not be a problem for you. You just need to weigh the benefits of purchasing your medications through these programs. And as you see there, there's a list. So these special generic pricing programs are offered at supermarket chains like Price Chopper and Wegmans and Stop and Shop and Hannaford. Also some retail sites like Rite Aid as well as Walmart. So continuing on with our special pricing programs, there's a program at Walmart where they offer Rely On Insulin, which is a brand name insulin manufactured by the Novo Nordisk company and sold at Walmart pharmacies. It's available to anyone regardless of income and insurance. You can purchase a 10 ml vial for $24.88 or a box of 5 3 ml pens for about $43. They have the products listed there on the screen, the Novolin R, which is short-acting, Novolin N, which is an intermediate-acting insulin. They have Novolin 7030, and then they also have the Novolin 7030 in the pens, which some people prefer. This insulin is not available in a long-acting product, so you must check with your prescriber before switching your insulin. You may need to test your blood glucose levels more often or even need a different dose. So again, it's very important before you ever switch your insulin to check with your healthcare provider. This program, like the previous program, is a cash price program, and the insulin does not get billed to your insurance. So you definitely need to weigh the benefits of this program to just purchasing the medication through your Medicare Part D plan, if that is what you have. So Rx Outreach is a low-cost, nonprofit, mail-order pharmacy. This program is great. They provide over 600 generic medications at low prices. This is available to anyone whose income is below $49,960 for a household of one, or $67,640 for a household of two. You can call the number listed on the slide or go to their website. It's a great program that offers many new generic medications at prices lower than even some insurance plans. Again, these are cash prices like the previous programs, so there's no billing to your insurance plan. You pay for them out of your own pocket for the medications, but it's worth taking a look at the list of medications and the cost. The list is quite extensive, and the costs often are lower than insurance plans. It's worth checking out. So I'm sure some of you have heard of GoodRx. GoodRx is a discount coupon program where you can go online and search for a medication, enter in the strength and the quantity to check pricing at different pharmacies when using the coupon. If you look at a medication and determine it is a lower cost option and you want to purchase the medication, you would print out the coupon and bring that to your pharmacy. Do keep in mind that when you use these coupons, you're purchasing the medication outside of your insurance plan. Also, please note that this program is usually a discount on the cost of the medication, and your insurance copayments could be cheaper. Also note, like previously mentioned, that if you're in the deductible phase with your insurance plan, it may be better just to use the insurance than getting, say, 10 or 15% off the cost of the medication in that deductible phase, because if you purchase it through the GoodRx plan, you're never going to get out of the deductible. So you really have to weigh the benefit of saving a little bit off the cost of the medication versus getting through your deductible so that you actually get to the copayment phase of your insurance plan. With that said, this program can be really helpful to individuals who have no insurance or maybe no coverage of a specific medication. I've also heard people use it to purchase medications for their pets. To access this program, you can go to the GoodRx website listed below. And as I've said previously, you can call the Pharmacy Outreach Program for help, and we can help you with all of these programs. So, Copayment Foundations. These are charitable organizations that help with the copayments associated with certain medications used to treat certain conditions. The three we primarily help people with are the HealthWell, the Patient Access Network, and the Good Days Foundation programs. How they work is that funds are usually available for certain conditions or diseases. If the fund is available for your condition, you can apply to receive assistance directly through these foundations. These programs are different than the previous programs because the medications need to be covered by your insurance plan in order for them to provide assistance. So the pharmacy needs to be able to bill your current insurance as your primary insurance, and then they'll bill the foundation for your assistance with the co-payments associated with those medications. There are income guidelines for these programs, but they vary. Usually when you're approved, you get a grant for the whole year, and you can use that towards the cost of the medication co-payments. You can access these programs by going to their individual websites. I didn't have enough information to list them all here, but I will put them at the end of the slide program today. Free trial offers may be available to help you with the cost of a medication. These are typically for new medications and are available to anyone to use to see if the medication works for you. You can obtain these cards at some prescribers' offices, so your healthcare doctor, maybe your primary care or your specialist, at different pharmacies, and I've also been able to find them through the manufacturer's website. So if you know who makes your medication, you can go to the website to see if they have one of these free trial offers for that medication. Keep in mind that they're only for a limited time. These examples on the screen for Latuda will only give you a 14-day supply, and Eliquis is for a free 30-day trial. So it's not going to help you long term, but might provide you with some free medication while you see if the medication is something that works for you. Patient assistance programs are programs that provide free or low-cost medications provided directly by the drug manufacturers, so the people that make the medications. They're providing the help to people who are in need because they lack insurance or because they might have not enough insurance to cover the medication. You fill out an application and you provide some supporting financial and prescription documentation, and you send it off to the company. If you are approved, the company mails the medication to your home or to your doctor's office. They may also send you a card that you bring to the pharmacy for free or low-cost fills for a duration of time. So where do you search for these assistance programs that I just talked about? Many of them can be accessed through the Needy Meds website, which is a great clearinghouse for assistance programs, and it's operated by a nonprofit organization. You can click on the link and go to the left-hand column of their web page and search by your medication name. The database will bring up a listing of options that might help you with the cost of the medications. I've been able to find patient assistance programs through the drug manufacturers, coupon programs, low-cost generic purchasing programs, either through retail sites as well as RX outreach, and information about the Copayment Foundations that I just discussed. On a side note, if all of this information is overwhelming to you, because it is for me at times as well, you can contact our program and somebody at our site will do all of the research for you free of charge. So when calling our program, it is important for us to be able to assess your situation so we can provide the best assistance possible. When you call us, we'll need to know the facts. What's the full cost of the medication? If you remember this, we might be able to look it up as well. How much is the copayment that you're paying? Does your plan have a deductible? Has the deductible been satisfied? Are you filling your medication for a 30-day supply or a 90-day supply? And are you filling your medication through the retail pharmacy like CVS or Walgreens, or are you using mail order? If you don't know the answers to these questions, that's completely fine. We can do research to find out the answers for you. And here is some additional information that will help us help you. So we might ask for the diagnosis or the reason why you take a certain medication. And we ask you that because the Copayment Foundations are very specific according to diagnosis. They provide funds according to different conditions or diseases. Again, current cost of the medication, current insurance. Is it a Medicare covered medication? You know, sometimes when we help people, we find out that the medication is actually not covered by Medicare. Or maybe it would be less expensive to get it covered through Medicare Part B, and we could help you with that if that is a possibility. Is the medication covered on the plan formulary? So the list of drugs that the insurance plan covers, we can do research to see if it is covered on the plan. If it's not, what other medications are covered in that drug class that you could take? Is there a generic equivalent for that brand name medication, and would that save you some money? And we'd be happy to do that research. Also, things like plan restrictions. A lot of times people have a hard time getting the medications that they need because they haven't filled out a prior authorization with their through their healthcare provider and insurance plan, and we can talk about that. We can also see if there's a certain quantity limit on the medication. Maybe you're trying to fill a larger quantity than what's allowed. Or maybe step therapy is required on your medication, and we can educate you about step therapy and talk to you about other medications that you may have tried in the drug class, and reach out to your provider to see if there's, you know, reason why you need this certain medication. And it might just be documentation that the insurance company needs to see in order to allow you to get that medication. We also, talk to people about FDA approved use of medications and off-label use. Is the medication available as a prescription only, or is it available as a over-the-counter medication? And all these are things that we consider when we do an assessment of your situation to see if there's some help to lower the cost of your medications. So I also just wanted to touch a little bit on, what's in a name? Medications in multiple formulations. And what we mean by this is that medications are available in different You can get them in different ways. You can get them as a brand or a generic. You can get them by prescription or over the counter. You can get a medication as an extended release or a sustained release or a controlled release as a topical. Maybe it is a topical. It could be a cream, an ointment, or a solution. These might all have different costs associated with them given the different formulation that the medication is in. And if you're flexible and it meets your needs, maybe purchasing a cream instead of a solution would save you some money. And we see these cost differences in insulin as well, vials versus pens. And switching from pens to vials might not be wise for some people that might have, low vision or dexterity issues. So we would consider all of that before we suggest a switch for you. So here's a slide of examples of cost and coverage differences for different medications that are the same but offered in different formulations. So for example, fluoxetine capsules versus tablets. We see that the tablets with the same strength, 20 milligrams, the full cost of the medication was $124, but if you got the capsules, it was just under $12. As well as metformin, the 1000s for a while, extended release, were very expensive. Nobody was buying them at that price. It was completely unreasonable. Maybe they were taking, instead of that, the metformin 500 milligrams ER twice a day. And then you can also see the difference in price for venlafaxine tablets versus capsules. For a while, people were calling us because they couldn't afford the tablets, but the capsules were much less expensive. So it's worth a call to us. We can look into this. This is an illustration of a Part D plan, so that's why you see the initial coverage level and coverage gap and the cost differences. But again, this is just showing you that sometimes it's just worth looking into to see if there's any cost difference for the different formulations of medications. So in conclusion, contact the Pharmacy Outreach Program with any questions about your medications or for help with cost issues. I know I provided a lot of information for you today. And we at Pharmacy Outreach are very well skilled, and we understand this whole world of medications as well as assistance programs and strategies, and we're here to help. There are many public and private programs to help with medication costs and strategies that can be used. There's no one solution for everyone, and we can do the research for you. So contact the Pharmacy Outreach Program if you would like to have a financial assessment or to have a medication checkup. Our toll-free number is 866-633-1617, and we're available Monday through Friday, 8:30 to 5. If you call after those hours or before those hours, you can leave a voicemail message and someone will give you a call back. We're staffed by case managers and pharmacists and pharmacy students from MCPHS University. Well, thank you for listening today. I appreciate your time. So on this slide are some program links for you that I mentioned I would put at the end of the presentation. So the program links being the Food and Drug Administration. Here's some information that you can access via the internet regarding disposal of medications. And then I included information about the Good Days Foundation, GoodRx, the Healthwell Foundation, Needy Meds, which is that kind of clearinghouse for a lot of programs to assist with the cost of medications. The Patient Access Network is another foundation program. Prescription Advantage, the awesome state program that is a secondary insurance to Medicare Part D and fills in that coverage gap. The Extra Help program, administered by the Social Security Administration to help with Part D costs, as well as the RX Outreach program, low-cost, nonprofit mail order program. Thank you.